Good morning, children. Sairam. So, how are you all, children? I hope you all are fine. So, first of all, I would like to show my gratitude to all of you for attempting first online periodic test so well. And I hope you all score also very well. So, children, without any further delay, let's start further online teaching learning process for the current academic session. So children, before exam, we started social and political life second chapter, role of the government in health, right? So in this video, we will continue with this chapter. But before moving further, what we have to do? Yes, first we have to recall once what we have discussed in previous video. So let's first discuss what is health. So what is health, children? In simple word, like we can say that health means our ability to remain free of illness and injuries. But apart from disease, we need to think of other factors also, because these other factors also affect our health. Like for example, if people get clean drinking water, pollution free environment, so they are likely to be healthy, because health is a vital aspect, right? Health is a vital aspect, because only healthy person can prove themselves resourceful. And adequate food is also very essential for keeping ourselves healthy. Is it clear? Okay. Now let's see the topic which we will cover in this video. So in this video, first we discuss healthcare facilities, private healthcare facilities and public healthcare facilities. Then we will discuss healthcare and equality. That means, is adequate healthcare services available for all or not? And at last, we will discuss what can be done. Okay, now move on to the first topic, public and private healthcare services. So children, basically we know that like the health of a nation is difficult to define in terms of a single set of measures. So basically in India, healthcare facility is divided into two categories. First one is the public healthcare services and the second one is the private healthcare services, right? Healthcare services in India divided into two categories. First one is the public healthcare services and second one is the private healthcare services. Now let's understand one by one. So let's start with the first, public health services. So first of all, public health services run by the government, right? And if we talk about the private health services, so private health services are set up by the individuals and corporate. So let's start with the first, public health services. So the public health services is a chain of health center and hospitals. As I said, these hospitals run by the government. Just note down this point, public health services, hospitals run by the government. Now they are linked together so that they cover both rural areas and the urban areas. Basically, these facility we have seen in both the areas, in urban areas also and in rural areas also. They can also provide treatment to all kinds of problems, from common illnesses to special services in both the areas, right? Okay. Now at the village level, if we talk about the village level, so there are health centers where there is usually a nurse and a village health workers. They are always worked there. They are very trained in dealing with the common illnesses, and they work under the supervision of the doctors at the primary health center, right? Just note down this PHC. PHC means primary health center. Now these nurses and these health workers, they are trained in dealing with the common illnesses and work under the supervision of the doctors at the primary health center. Now such a center covers many villages in the rural areas. As I said, the hospitals, public health services are run by the government. So this kind of services and this kind of hospital we have seen in both the areas, in urban areas and the rural areas. They work in both the areas. So such a center covers many villages in the rural areas. Now if you talk about at the district level, so at the district level is the district hospitals, right? That causes supervisors all the health centers. Now the health services are also called the public for many reasons. Why? If in order to fulfill its commitment of providing healthcare facilities to all citizens, because it is the responsibility of the government to provide healthcare, quality healthcare services to all the citizens of the country, right? Especially the poor people and the disadvantaged group of the society. So in order to fulfill its commitment of providing health care to all citizens, so the government has established these hospitals and health centers. Now also the resources needed to run the services obtained from the money that we the public pay to government as taxes, like whatever we have paid as a tax to the government, so in return government provide this kind of facility, health facility, education facility and so on. Now one of the most important aspects of the public health system is that this is meant to provide quality healthcare services. Now quality healthcare services like either free or at very low cost. That means the services they provided, that means in public healthcare centers or the hospitals, so they provided services either free or at very low cost, so that even the poor people can seek treatment. Now another important, like how is not the public health is to take action to prevent the spread of diseases like such as the TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. and etc. And this has to be organized by the government with the participation of the people, otherwise it is not effective. So public healthcare services, as I said, these services run by the government, right? Now their aim is to make healthcare facility accessible to all the citizens of the country, mainly poor and disadvantaged people. Second thing is, it is the responsibility of the government to provide quality healthcare services to all the citizens of our country. That means it is the responsibility of the government. They provide these services either free or at a low cost to improve the health situation in our country, right? Okay, now just move on to the next one, private health facility. So as the name suggests, private, these facilities are not controlled by the government. Just note down this point. Private health facilities, these facilities are not controlled by the government. These facilities are run and set up by the individuals and corporates. So in India, there is a wide range of private healthcare facilities that exist, and large number of doctors, they run their own private clinics. Like as I said, as the name suggests, private healthcare facilities are not controlled by the government. These controlled by owned and or the individuals. If we talk about the public healthcare services, so unlike public healthcare services, in private healthcare services, people have to pay lot of money for each and every services that they used. And today, in presence of private facilities can be seen all around. In fact, now there are large companies, they run their own hospitals, and some of them they engaged in manufacturing and selling of medicines. And like many shops, many medical shops, we found it in each and every corner of our country. But still, these facilities, these health facilities is not accessible to everyone, to all the citizens of our country. Okay, now move on to the next topic. Like, is adequate healthcare available to all or not? So our next topic is healthcare and equality. So, children, as we know that although India is a democratic country, not all Indians get equally good healthcare facilities. Okay, basically in India we are facing problem. Now, what kind of problem we are facing? Basically, in India, private facilities are increasing day by day, but public facilities are not increasing. Now, what is then available for the people? Mainly private facilities. Now, these private facility, they mainly concentrated in the urban areas. And whatever services they provided, these services are also very expensive. Medicines are also very expensive. So people cannot afford these expensive facilities and services. Even sometimes people borrow money for their treatment. So now the reason is because of the population of India is huge. Basically, as I said, not all Indians get equally good health care. This is because the population of India is huge, and also because most of the new medical staff and facilities are we have seen in the cities, whereas most Indians live in villages. As we know that, like, still most of the Indians they live in villages, and these medical facilities we have seen in cities. Most have healthcare systems in towns and cities are privately run by for their profit, and these facilities are also too expensive for many people. Now just note down this point. Barely only 20% of the population in India can afford all the medicines they need. Right? How many? Barely 20% of the population only can afford all the medicines they need. And according to one study, 40% of the patients in hospitals have to borrow money or sell their positions to pay for the medical expenses. Then what about those who are poor? Like, every illness in the family is a cause of great anxiety and distress. What is worse is that situation tends to happen again and again, and those who are poor are in the first place undernourished. Now, these families are not eating as much as they should. Even they are not provided basic necessities like proper drinking water, like proper adequate housing facilities, cleaning surroundings. So therefore are more likely to fall ill, and their expenses on illness make their situation even worse. Now sometimes it's not only the lack of money that prevents people from getting proper medical treatment. Women, like for example, women are not taken to a doctor in a prompt manner, as we know that. So women's health concerns are considered to be less important than the health of men in the family. Even we have seen like many tribal areas, they have few health centers and they do not run properly even. Sorry, they do not run properly even. Even the private health services are also not available there. Now, what can be done to improve the healthcare facility in India? Okay, now move on to the next topic. What can be done? Okay, children, basically, there is a little doubt. In health situation of the people in our country, it's not good, right? So it is the responsibility of the government to provide quality health care services to all the citizens of the country, like mainly poor and undernourished and disadvantaged people of our country. Basically we know that like health is much dependent on the basic amenities and social condition of the people, right? So however it is very important to work on the both. We work on the both to improve the health services in our country, and yes, this can be done. So let's understand with the help of the example. So here we have to take two example. First is the Kerala experience and the second one is the Costa Rica approach. So basically, as I said, like it is the responsibility of the government to provide quality health services to all the citizens, especially the poor and the disadvantaged group of the society. And as I said, like health is as much dependent on basic amenities and social conditions of the people as is on healthcare services. Okay, let's start first. Okay, so let's start first the Kerala experience. In 1996, the Kerala government made some major changes in the state. Basically, they decided 40% 40% of the entire state budget they was given to the panchayat, right? In 1996, the Kerala government made some major changes. They decided 40% of the entire state budget they given to the panchayat, so they could plan and provide for their requirement, and this made it possible for a village to make sure their proper planning was done for regarding water, food, women's development and education. This meant that water supply schemes were checked, the working of schools and Anganwadis were also ensured, and specific problems of villages were taken up. Now health centers were also improved in villages. All of these helped to improve the situation. But despite these efforts, however, like some problem, for example, like such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and these needed to be addressed also, right? Okay, now let us look at the example of another country, the Costa Rica, its approach to issues of health. Basically, Costa Rica Costa Rica is considered to be the one of the healthiest country in South America, right? South America. Costa Rica is considered to be the one of the healthiest countries in South America. The main reason for this can be found in the Costa Rican Constitution. Basically, students, several years ago, Costa Rica took a very important decision. They decided not to spend their money on army. This helped the Costa Rican government to spend the money that the army would have used on health, education and other basic needs of the people. So the Costa Rican government believes that a country has to be healthy so for its development and pay a lot of attention to the health of its people. The Costa Rican government provide basic services and amenities to all Costa Ricans. Like for example, it provide safe drinking water, provide sanitation, nutrition and housing. Health education is also considered very important there, and they also consider knowledge about health is also a very essential part of education at all levels, right? So basically, as we know that in democratic country or in any country, it is the expectation of the people that government work for the welfare of the people through the provision of providing proper education, proper health facility and so on, because it is the responsibility of the government providing better healthcare facility, quality healthcare services to all the citizens of the country to improve health situation of the people, right? Okay, so this is all about your chapter. Now let's discuss few question answer. So first question is, describe the functioning of public health services in rural areas. So as we discuss about the public and private healthcare services, so as I said, like public healthcare services, they work in both the areas, urban areas and in the rural areas. So here we discuss the functioning of public healthcare services in rural areas. Public healthcare services in rural India are most basic unit of healthcare, and presently they are operated 23,109 primary healthcare center, it's PHC. They run healthcare program and so many campaign, and they also provide basic facilities in rural areas. Like for example, government set up pulse polio campaign in 1995-1996 to eradicate polio in India. Okay, now the next one is compare the private and public health care services. So public healthcare services, these services run by the government and controlled by the government. Private healthcare services, these services are not controlled by the government, right? These services set up and run by the individuals and corporate. Now their aim is to make healthcare facility accessible to everyone, to all the citizens of the country. And if we talk about the private healthcare services, their aim is to generate business and make profit. Now, government operate these functions, and this function in urban and rural areas at very low cost or either free. And these facilities, that means the private healthcare facilities, is well occupied and normally available in urban area, right? I hope now your all doubts are clear now. So, thank you children, and have a nice day.